Hello everyone. In this video, I'm going to discuss about aortic dissection, which is considered to be a medical emergency. Let's get started with the definition. Aortic dissection, as the name suggests, is an injury to the aorta in such a way that the layers of the aortic wall are forced apart and blood is now allowed to flow between these layers. Aortic dissection can quickly lead to death from insufficient blood flow to the heart or complete rupture of the aorta. That's why it's considered to be a medical emergency. So, the aorta, like all the blood vessels in the body, has three major layers. This is called the tunica intima, the tunica media, and the tunica adventitia, from innermost to the outermost. In aortic dissection, the tunica intima is damaged, leading to the flow of blood into the media, which is weakened due to a variety of reasons. Sometimes a blood clot is formed in the media, and this is also considered to be aortic dissection. The risk factors which lead to this include increased blood pressure, increased heart rate, or a hypercoagulable state where platelet activity may be increased, or decreased activity of the fibrinolysis pathway, which is responsible for the destruction of blood clots. Even though these are the risk factors involved, the patient usually has some causative factor which leads to a weakened aortic wall. Here is a list of some of the factors which may be responsible for an aortic dissection due to a weakened aortic wall: hypertension, connective tissue disorders, congenital aortic valvular defects, autoimmune diseases or infections, aortic coarctation, cocaine use, pregnancy, trauma, or iatrogenic injury. Here is a picture showing the two different types of classifications of aortic dissection. The DeBakey type is classified into 1, 2, and 3, while the Stanford classification is divided into type A and type B. These classifications are used to determine the extent of the dissection. The classic symptoms of aortic dissection include chest or back or abdominal pain, cold legs or paraplegia, or collapse may also occur in certain cases. While the common signs observed are different blood pressure in both the arms, cardiac tamponade or acute aortic regurgitation may occur, and hypotension leading to a collapse may also occur. Complications of aortic dissection include stroke, mesenteric ischemia, myocardial ischemia, etc. And rarely, the rupture of this aortic dissection leads to hemorrhage into a body cavity like retroperitoneal hemorrhage or pericardial ruptures. Here is a flowchart showing how to proceed with the diagnosis of an aortic dissection. When a person first comes with tearing chest pain radiating to the back, we get an ECG. If certain ECG changes are observed, then we treat appropriately. If the ECG is normal, we may proceed with a chest X-ray, which may show widening of the mediastinum, but it is not specific. Some specific imaging tests which may lead to the diagnosis include TEE, transesophageal echocardiography, or chest CT with contrast, and in non-emergency cases, MRI is also used. Here we can see how it appears in various imaging tests. This is a chest X-ray. Here we have a CT with contrast. Here is an MRI, and here we have an ultrasound. Finally, let's talk about the management. Medical management includes mainly lowering down the BP gradually. In very high blood pressure, sodium nitroprusside may be given intravenously, and this is followed by a beta blocker. And if the beta blocker is not effective enough, we go for a calcium channel blocker along with it. It is advisable to reduce the BP by less than 20% initially. The target for mean arterial pressure is 65 to 70 mmHg, and for heart rate, it's less than or equal to 65 beats per minute. Surgery is also an important option in certain cases where there may be an acute proximal aortic dissection or an acute distal aortic dissection with one or more complications mentioned before. Here is a list of some of the procedures which are undertaken. These include an open aortic surgery, Bental procedure, David procedure, or thoracic endovascular aortic repair. This one is the least invasive and is usually combined with ongoing medical management. The decision for the appropriate surgical procedure is made by the vascular surgeon. Also, these surgical procedures are not devoid of complications and are risky themselves. With this, I would like to conclude this video. I hope you guys found it useful. Thanks for watching and stay tuned for more.